I think AI has a growing place in healthcare, particularly around transitions of care. Generally, if you think about the weakest link in our healthcare ecosystem, it's usually when an individual patient transitions from one care setting to another and conversely goes back and forth. We are often struggling with different uh, data sources and repositories of information, whether it's EHRs, population health tools, payer platforms, etc. And when the patient transitions, there's a pretty good chance they're going to be we'll say they're going to be managed in potentially a different data set or different set of technology tools. And with interoperability slowly improving, but not yet, at the place where everything's seamless. That is the weakest link, and that is essentially where I think AI has the greatest potential to make a big impact. That is where errors occur. That's where communication gaps exist. And we need to utilize, employ AI technologies to help those caregivers or entities bearing the risk downstream to summarize information in a cohesive and we'll call it brief way. There could be, and often is, too much information, for example, sent from a hospital to a post-acute care setting, like a skilled nursing facility. They usually come in the form of a thick yellow manila envelope with 100 different pages and often conflicting information. And AI can essentially help us summarize that information in a way that allows us to improve intake, improve high yield information transfer to the next care setting. So that's one example of how AI I think is getting adopted pretty readily in the market. There's a big appetite for that what we're sort of calling chart summarization use case. And then there's also the ability to synthesize what's actually happening with the individual at the point of care today. So, for example, if a patient transitions from a hospital to a post-acute care setting, let's say a point-of-care facility, we can help the care team that might be responsible for that individual patient, particularly if they're in a risk-bearing model with managed care or an accountable care organization. They need to follow that patient across the continuum, and we are inventing and improving tools to essentially help organizations be able to do that efficiently through a collaborative way. So this way, for example, today, if I was to follow a patient as a doctor discharging them from the hospital, I really wouldn't have an easy way to go log into a facility where I may not be credentialed, where I may not have access to then understand how, my patient, Mrs. Jones, that I discharge is doing. What PointClickCare is bringing to the market through the use of AI is summarizing that full chart of Mrs. Jones based on their situation performance today and really providing a way to not only understand what is changing, because often that's really what we want to know is what's changed as opposed to we need to know every little piece of information, not only what's changed so we can focus our clinical teams and resources there, particularly if there's a new risk, but also what's around the corner. So being able to predict prognosis and understand whether somebody's going in the right direction or maybe having a downward trajectory is where AI is going to have a very important application in improving clinical care and helping the care team manage any high yield changes in condition. When organizations like managed care are partnering with either health systems, practice groups, post-acute care partners, they are looking at identifying opportunities to mitigate risk and reduce unnecessary healthcare expenditures, right? And so AI could enable those shared risk partnerships by helping with that, data transparency in a way that allows them to tell a story across a continuum. So as an organization taking a risk, I'd love to reduce the risk of readmission for an episode, right? Particularly. And that episode, within that episode, that could be a 30-day episode, could be a 90-day episode. I could be taking a risk for the full year. And now I need to track this patient as they go in and out of different care settings. And so using AI to predict their risk of return to hospital is really, really important. There are a number of different models out there, but they're often very pinpoint to the care setting. So there are tools in the acute care setting, the hospital setting that are used to predict readmission risk. But once a patient leaves that hospital, you need different tool sets to be able to predict how their condition or change in condition is impacting that risk score. So you might be using different risk models depending on whether you want, a much more global understanding of an individual's risk, or you want something very, very specific. You want a model that's going to predict their, let's say, risk of return to the hospital for, a COPD patient versus, this is a very frail individual. They have multiple medical conditions, and what is their likelihood to be readmitted? Those are very different models depending on the use case and the abilities of the clinical team. AI can help, I would say, combine different models in a way that tells a story, as opposed to just looking at a snapshot in time, which is kind of where we were historically.